One of the unique things that I do in my surgeries is I give you what we call a local penile block. What that means is I block the nerves to the penis and the scrotum. What this provides is a pain-free experience immediately after the surgery, and the block typically lasts about 2 to 3 days. In the event that you have some additional pain needs, I do give you oral pain medications. And these medications are typically needed for about 10 to 14 days. There are several things that I rely on you to do to improve your recovery. I expect you to ice your scrotum as much as you can after the surgery. I expect you to wear tight scrotal support, and this includes a jock strap, bike shorts, which are my favorite, or any kind of tight compressive underwear. And the reason you do this is it'll reduce your swelling and improve your healing, and it'll expedite how quickly you'll recover. For the most part, I just want you to leave the incision site alone. You don't have to pick at it if it has glue. If there's stitches there, I don't want you to touch them. You'll have a drain, which I want you to take out about 2 days after surgery. And 2 days after that, I want you to start showering. Until then, you can just dab the area with a wet cloth. Once you start showering, you can dab soap and water on the area and dab it dry. But the most important thing is leave the incision alone and don't pick at it. As your swelling goes down, you'll start noticing a very mild bulge in the scrotum, and that is probably your pump. Whenever the soreness has gone down enough where you can grab it or hold it, I want you to start gently pulling it down. The easiest way to do it is when you're in the shower, let warm water run down, and during that time, pull the pump down and hold it down for about 90 seconds. This is your opportunity to get the pump in the location that you want it. As I mentioned before, one of the things I do to reduce your pain is give you a local anesthesia. By giving you a local block, that reduces your needs for pain meds. If the pain is low enough where you can just simply take ibuprofen or Tylenol, then I encourage you to do that because it reduces or eliminates constipation. If you need the pain meds that I gave you, then I encourage you to take Colace or some sort of stool softener with it to reduce the possibility of constipation. You definitely want to avoid heavy lifting after surgery. Heavy lifting can increase pressure down in your scrotum, and that can result in increased risk of bleeding or breakdown of some of the sutures that were placed in there. I would also avoid showering until 2 days after the drain is removed. And the reason for that is because you have a small hole where the drain was sitting, and if you shower too early, that can allow non-sterile water to get into the area where the prosthetic is sitting. We typically recommend you avoid driving for 24 hours after you received anesthesia. If you're not requiring the oral opioid pain medications, then you can start driving immediately after that period. If you're taking opioids, we recommend you avoid driving. You can return to work typically after about 2 weeks. That includes light activity. If you do heavy lifting for work, then we certainly recommend you wait until 4 to 6 weeks after surgery. Most people will tell you that the recovery period for this type of surgery is about 6 to 8 weeks. For my patients, the recovery is more like 3 to 4 weeks. And so that means in 3 to 4 weeks from the time of surgery, you're ready to use it. The reason is because I make a very small incision, only about 2 to 3 centimeters. We limit the amount of manipulation you need to do, and we do the surgery as efficiently and quickly as possible. And on your end, what this allows you to do is recover quicker and start using it quicker. A common phone call that I get after surgery is, "Hey doc, everything looks swollen and bruised. Is this normal?" That can be normal, and typically all that means is you just haven't iced it enough and you're not wearing tight enough compressive shorts. Bruising and swelling are a normal post-op recovery course. But what is abnormal is redness, if everything looks red and beefy, if there's drainage that looks more like white, chalky material, if you're having fevers, or if you're having significant burning or bleeding when you urinate. In those settings, that I absolutely want you to call me and let me know. Your post-op recovery follow-ups go as such. Typically, about 2 to 5 days after your surgery, you'll come in to have your drain removed. If you had difficulty emptying your bladder after the surgery, then you'll have your Foley catheter or bladder catheter removed at that same time. After that, I just want you to heal. I typically don't see you until 3 to 4 weeks after the surgery. When you come in at your 3 to 4 week appointment, that's when we start talking about inflating, deflating, and you start learning how to use the implant. On that day, you're actually ready to use it, and you can actually go home and start practicing. As you recover from your surgery, more questions are going to come up. I'm, of course, always available for those questions, and of course, you'll have ample opportunity to come in and talk to me in person. You'll have contact numbers for patient educators who have gone through the surgery, and those are a great resource for you to take advantage of and call. They've been through the recovery process. They can tell you whether what you're going through is normal or not. If you have any concerns, of course, I always want you to reach out to me.